The biggest debate everywhere, in virtually every household I know right now, is over whether someone who's asymptomatic, which means that he's not demonstrating any symptoms, but may have potentially come in contact with somebody who has coronavirus, should that person be tested or not? Logic says yes, the government says no. And the reason that the government says no is because they think that capacities are being overwhelmed and that private labs can't manage. When we speak to the private labs, they say we can manage just fine. And they suggest that this is being done by the government to try and artificially deflate the coronavirus cases. So it doesn't seem as if the situation is spiraling out of control, because if you don't test, you don't know. Every single medical expert I spoke to said this is an absolutely counterproductive strategy. Here's our report.
The Delhi government has issued show-cause notices to private labs in capital for testing asymptomatic people for COVID-19. The private labs have been accused of going against the guidelines issued by Indian Council for Medical Research. The Delhi government says that the labs were doing around 6,000 odd tests on a daily basis, putting extra load on cities' health infrastructure. The movement has sparked off a massive debate, as asymptomatic patients can be carriers of the virus that can be passed on to those who are more vulnerable.
ICMR has given guidelines. That's not a law. ICMR has given contradictory guidelines. They have also given guidelines that those people who are pre-symptomatic, their discharge policies, the very fact they write pre-symptomatic, it means that pre-symptomatic needs to be diagnosed, and they cannot be diagnosed without a lab test.
According to ICMR, only symptomatic patients with travel history, those who are contacts of COVID-positive patients, and symptomatic healthcare workers must be tested. Patients with severe respiratory infections, high-risk contacts of COVID patients, symptomatic patients within hotspots, hospitalized patients who develop symptoms, and migrants who are symptomatic also need to be tested.
So if they are not spreading the disease, if you cannot take public health actions, I really do not see the reason why you should be testing asymptomatic people. So I think ICMR is right in terms of their current position in terms of testing only symptomatics.
With COVID-19 cases in India hitting the 2 lakh mark, the ICMR is planning to scale up testing from 1.5 lakh tests per day to 2 lakh tests per day by June end. At a time when country has begun opening up after an extended lockdown, will the strategy to not test asymptomatic patients prove counterproductive? With Milan Sharma in New Delhi, Bureau Report, India Today.
Dr. K.K. Agarwal has been president of the Indian Medical Association. He heads the Heart Care Foundation. He joins us on this broadcast. The government says that asymptomatic patients shouldn't be tested. Dr. Agarwal, why do you think that this is such a disastrous strategy? Why is it that you wish to challenge this in a court? You know, you're seeing some images from inside some of the hospitals where so far efforts were being made, and I'm just being told that Raghav Chadha from the Aam Aadmi Party was to join us on the show, but now he's not taking calls, which is just so unfortunate, because when citizens are in distress and when leaders need to step up to the plate and answer questions, for them to be so unprofessional, so uncaring and so callous is simply not acceptable. He saw the show. He was to join us at 8:30 p.m. and then Raghav Chadha of the Aam Aadmi Party, after having seen what was being shown, decided he didn't have the answers and therefore would not join. Raghav, I know you're watching live even at this moment. Every person who's messaging me and reaching on social media would like the government to have some answers out. If you care for your citizens, the least you should do is to come and to answer questions. Otherwise, you're just a completely irresponsible public representative. The choice really is yours. Dr. Agarwal, why is it that you believe that the strategy being followed by the Arvind Kejriwal government is so deeply flawed? Explain that to our viewers.
There are a couple of things. First thing is, everybody is blaming ICMR. Everybody is saying ICMR policy. But if you see ICMR discharge policy, they write very clearly mild, very mild, and pre-symptomatic cases discharge. Pre-symptomatic cases cannot be discharged without a diagnosis. And pre-symptomatic includes asymptomatic. Nobody is reading the actual discharge policy of ICMR. That's one. Because we cannot differentiate asymptomatic from pre-symptomatic.
What's the difference? I'm sorry, I didn't study much medicine or biology. What's the difference between pre-symptomatic and asymptomatic?
Pre-symptomatic means I'm going to develop fever tomorrow. I'm symptomatic, but I will be symptomatic tomorrow. My test is positive 48 hours before. I'm going to be positive after 2 days. That is called pre-symptomatic. Now, pre-symptomatic diagnosis, these are the patients who are carrier. 1 out of 5 is a super spreader. You require only one super spreader to have what happened in Delhi in the community when you talk about it. Was one super spreader who spread it to everybody. One single super spreader can infect. So therefore, number one is asymptomatic, pre-symptomatic needs to be tested. That's one. Number two, the most important thing is pre-symptomatic cases can be dangerous. They can spread. Today, even as a doctor, if I am coming exposed to some patient, I can't get a testing done because I am asymptomatic at the moment. Number two, government says symptomatic means fever, cough, and breathlessness. But most of the people are presenting with the diarrhea, with rash, with COVID rash. There are so many other symptoms which people are presenting. You may present with the diarrhea today and fever and cough 3 days later. I think it has to be on the doctor to decide. There is no reason why you should cancel the license of 8 labs because they have not to be blamed. If you want to blame the people like us who are writing the investigation. It is the doctors who are writing the investigation, not the labs. And if you take away our right of referring whether we are suspecting a patient or not, I don't think so it's right. Even ICMR has no right to dictate us that you cannot refer a patient or you cannot treat, you cannot refer
Dr.
a patient.
Agarwal, stay with me. You filed a petition against the government.
Hello everyone, this is Rahul Kamal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel and don't forget to press the bell icon to stay updated.